Hello friends, myself Kuldeep Pratap Singh, roll number 41, and my topics are drugs for Alzheimer disease, cognitive enhancers, CNS stimulants, and psychopharmacology. Drugs for Alzheimer disease. It is a degenerative disease of the cerebral cortex with decreased cholinergic transmission. Drugs used are donepezil, galantamine, and rivastigmine. They are cerebroselective anticholinergics. They increase cerebral level of acetylcholine and have shown to produce some benefit in this patient. Other drugs used are memantine, ginkgo biloba, etc. Cognitive enhancer. Cognition enhancer are drugs which help to reduce the impairment of cognitive functions associated with age, head injury, stroke, and neurodegenerative disorders. They improve memory. Cognitive enhancer. The drugs are rivastigmine, donepezil, galantamine. Route of administration oral. Mechanism of action anticholinergics inhibit both true and pseudocholinergics. Increase cholinergic transmission in the brain, improvement of cognitive function. Use mild to moderate Alzheimer disease, produce small improvement in cognition. Donepezil can be used in severe cases. It is administered once daily. Adverse effect gastrointestinal side effects. Next drug is memantine. Route of administration oral. Mechanism of action inhibits glutamate transmission. Use moderate to severe Alzheimer disease. It can also be used in combination with anticholinergics. Adverse effect dizziness. Next drug is paracetam. Route of administration oral intramuscular. Mechanism of action decreases viscosity and improves microcirculation. Neuroprotective effect. Uses dementia, adverse effects, insomnia, headache. Next drug is citicoline. Route of administration oral, intramuscular, intravenous. Mechanism of action increases oxygen and blood flow to the brain. Use vascular dementia, Parkinsonism, stroke. Adverse effect headache. Next drug is pyrimidine. Route of administration oral, mechanism of action dopamine agonist. Use dementia, Parkinsonism. Adverse effect nausea, vomiting. Next drug ginkgo biloba. Route of administration oral, mechanism of action neuroprotective. Use evidence for clinical benefit in dementia is not convincing. Adverse effect avoided in patient on anticoagulants increase risk of bleeding. CNS stimulants. The drugs are doxapram. Route of administration intravenous fusion action respiratory stimulants stimulates peripheral carotid chemoreceptors plus direct stimulation of respiratory center. Use respiratory depression following general anesthesia, drug-induced respiratory depression. Adverse effect nausea, vomiting, arrhythmias. Next drug is modafinil. Route of administration oral action psychostimulant enhances wakefulness and vigilance. Use narcolepsy, shift work, sleep disorder. Adverse effect headache. Next drugs are amphetamine, dextroamphetamine. Route of administration oral action increases norepinephrine dopamine level in the synaptic cleft in the brain. CNS stimulants. Use ADHD, narcolepsy. Adverse effect insomnia, tachycardia, palpitation. Next drug is methylphenidate. Route of administration oral action increases norepinephrine dopamine level in the synaptic cleft in the brain. Use ADHD, attention deficit hyperkinetic disorder. Adverse effect suppression of appetite, weight loss. Atomoxetine, norepinephrine reuptake inhibitor. Route of administration oral, used in the treatment of attention deficit hyperactivity disorder. Increases ability to pay attention and decrease hyperactivity. Adverse effects include insomnia, gastrointestinal side effects, rarely suicidal ideas. Psychopharmacology. The major type of psychiatric illness are psychosis and neurosis. Difference between psychosis and neurosis. Psychosis, major mental illness, and neurosis, minor mental illness. Psychosis, insight into the illness is lost, and neurosis, insight is present. In psychosis, judgment is lost, and neurosis, judgment is not lost. In psychosis, disturbance of mental function, and neurosis rare. In psychosis, disturbance of thought present, example schizophrenia, and neurosis, disturbance of thought rare, example anxiety, neurosis, phobic states, obsessive compulsive disorder, hysterical attacks, reactive depression, etc.